This conference will now be recorded.
Okay, so we're going to start recording. So again, thank y'all for coming this afternoon. Just a few housekeeping notes. Please remain muted unless your presenter, which is Tiffany. If you have any questions or comments, please make sure to submit those in the chat function, which is right here. You guys should see that right there pop up. If you have questions or comments, things like that, just pop them in there throughout the session. We'll also have some time at the end for some questions and answers as well. A recording will also be posted to the Chamber's Chamber's website at etowahchamber.org/COVID-19. But with that being said, that's just a few housekeeping notes. I'll go ahead and turn it over to Tiffany if you want to take it away, Tiffany.
Thank you. Hey, Will. Aren't giving me the option share.
Let's see, Tiffany. Yeah, you're set as the presenter, so you should be good.
All right, let me minimize this here.
Okay.
Oh, there we go. I got it now. Just had to push the right button. All right, here we go, everybody. How is everybody doing today? I know you can't answer me. I'm not sure if you can still see me or not, but I am really going to try hard to sit here in this chair, which is very difficult for me to do while I'm talking. Normally I talk with my hands and get up and walk, and I really like to interact with my audience and really get everybody involved. So maybe at the end, with some Q&A, we'll be able to interact a little bit. That would be wonderful to be able to do that and give us all a little bit of a chance to socialize, which is one of the coping skills that we are going to talk about today. And I just want to say thanks, y'all, for joining me today. And I'm very excited for this opportunity to be able to speak on mental health during a time of crisis right now. As Will said earlier, you know, a lot of topics have been presented over this platform over the last week or two or 3 weeks, and they have all been very helpful and very crucial in our everyday life. And I think that mental health is something that we need to be very aware of during this time. And when I say mental health, I mean that in the sincerest of terms possible. Health. You know, when we think about health, we think healthy, we think good, we think, you know, the best that it can be. So that is where I'm coming from. That is the perspective in which I'm coming from. I'm not talking on a mental illness platform. We will talk about some things that are mental illness related, and we'll talk about when to get some help and things of that nature. But we're talking on mental health and how to stay healthy during this time. This is new for all of us. But again, my name is Tiffany Holcomb Works. I'm a licensed Bachelor of Social Work, and I have a master's in counseling, and I'm also a full-time student at Jacksonville State University, working on my second master's degree in social work. I currently work for Gadsden Regional Medical Center as the Community Outreach Coordinator for Behavioral Health Services, and I'm kind of grounded right now. So I am working at the hospital, helping out with some discharge planning and different things that are going on here. It's been a little bit of a change up for me. I'm normally in my car driving around, and I'm getting to socialize with some of my fellow coworkers who I love very much. Some of you are on here today, and I'm glad to see all of you. So it's a new opportunity for me, and it's a change for me, and we're going to talk a little bit about that as well. So we'll move on to the next slide. Or I want to also let you know that some of you may know me. I don't always look the same. Sometimes I'm in a uniform, volunteering as a reserve deputy or a chaplain, and most people don't recognize me when I'm in that uniform. Or you're going to see me in some scrubs if I'm in a mask. If I'm here at the hospital, I am isolated in a room right now, so I can go mask free right now. I'd hate to do that with a mask on today. So thank y'all for being here. So we'll move on to the next slide. Well, there we go. So first of all, I want to give you the definition of mental health. And according to the dictionary, mental health is a person's condition with regard to their psychological and emotional well-being. Makes sense, right? And I know that we spend a lot of time at work, and I know that things are really different right now, and we're learning new things, such as presenting on a go-to meetings such as this. I'm sitting in front of my computer, you're sitting in front of yours, and a lot of us have the opportunity to be able to work from home. Some of us don't. But when we are at work, that's who we're spending the most of the time with, is our coworkers, and they become like family to us, and we rely on them. And oftentimes we may actually even get along like family. I don't know if that's a good thing or a bad thing, but sometimes that is the case. So we're close, we're families, and according to Paul Farmer, the workplace is often the most stressful place a person finds themselves. Employees and managers need to keep an eye out for signs of deteriorating mental health in fellow colleagues. So it's important for the leaders in our organizations to pay attention to those of us that are employed by them. And I think that's one of the biggest keys that I want most people to take away from here. If you're in a leadership role and you are in management, I really want you to think about that, because right now is really when your employees need you the most. So some of the things that we're going to look at today, we're going to look at 4 different areas. We're going to look at behavior, we're going to look at body, emotions, and thinking. And we're going to talk about a few of the symptoms related to each of those 4 areas and how they're related to stress or anxiety or different things that are related to our mental health during a time of crisis. So I have a little, let's see if I can get this to work. There it is. There's the play button. Before I play this little video, and it's a little comical, and it's really short and sweet and simple. I hope that you enjoy it. I searched really long and hard for one that was really short and that would keep your attention. But we have natural instincts as far as back as the caveman. I mean, as you see in this little cartoon here, it's a little caveman there. And our natural instincts are fight, flight, or freeze, which is a response to our body's natural reaction to danger. And while the COVID-19 is not like this immediate visual danger or threat that we can see or touch or feel, it is still very much a perceived danger to all of us. It's a type of stress response, or the natural instinct that we have is a type of stress response that helps us to react to perceived threats like an oncoming car or a growling dog. And as you're going to see in this video, a growling saber-toothed tiger, I believe that's probably what that is. Freezing or fight or flight is flight on hold, where we further prepare to protect ourselves. So we have options. And basically what happens with our natural instincts is we have an upwelling of adrenaline and cortisol. And adrenaline is something that a lot of us have experienced on several different occasions. We experience adrenaline when we're excited. We experience adrenaline when we're afraid. And cortisol is a hormone that is secreted in our bodies that, and I know you've all seen this commercial about belly fat and the cortisol and all of that. Well, it's true. I mean, you know, we do secrete cortisol, and it is something that happens with this natural instinct to this this unseeable threat that's happening in our lives right now. So that cortisol is ramping up right now. So without further ado, I'm going to take you to a little demonstration of our natural instincts.
Stress may seem like a byproduct of modern life, but the feelings which cause it are as old as humanity itself. An important part of our evolutionary heritage is the physiological capacity to respond instantly to a threat or anything we perceive as a threat. We've come a long way, but the fight or flight response is still there. Today, we call it stress. This innate reaction automatically prepares us for direct and decisive action. Unfortunately, our body responds the same way, even when direct physical reaction is no longer appropriate.
All right, so that kind of just gives you a little bit of an idea. I mean, we were born with these natural instincts to be able to do that. And some of us, you know, as you heard, it's our perceived threat, you know, how we perceive the threat. Some of us are going to look at this stress or look at this situation a little bit differently than others, you know, while others may get really upset about it or have really high levels of anxieties, and others of us may be able to remain a little bit calmer, or some of us may be able to just hide it a little bit better. So it really just depends on, a lot of times with the fight or flight, it depends on how you responded to other things in your past, so look at some things in your past and how if you've been scared or excited, look at how you responded to those situations, and it could very well give you a good idea of how you might be responding in this situation. So, as our natural response, and right now, this is uncharted waters. We really don't know what to expect next. Here at the hospital, changes are happening every day, and we're constantly having to readjust. And I don't know about y'all, but changing in my routine every day is not good for my mental health, because I am such a creature of habit, and I know that most of us are. We'll talk a little bit about establishing some habits or structure and schedule and routine in our lives to help with some of the stress.
Stress may
I don't
seem
need to
like
do
a
that.
byproduct of modern life.
So a friend of mine who I work with shared these tweets with me, and I found it very interesting at how it directly relates to our natural instincts. So I'll just kind of read it to you. Do you know why you feel so tired, even though your daily activity load is decreased? Right now we're sitting in front of a computer. I'm not walking and talking with my hands and moving around. I definitely don't appear to be exerting as much energy as I normally would. It's a trauma response, crisis response, because you can't fight the virus actively, because you can't run away from it. Your body's going to play dead. So we're going to play possum, if you've ever heard of that term before, or that saying. It's a common in those who experience ongoing trauma in their childhoods, and it's happening now. So even though we may not have experienced trauma in our childhood, does not mean that we're not going to be experiencing some of the same feelings that some other people may be experiencing right now. We're powerless. Fight or flight is out. What we're used to doing and how we're used to responding isn't working in this situation, and we're not able to respond how we normally would. And so the only coping strategy that we have left is to just avoid it. We don't want to face it. We don't, it's almost surreal sometimes. And I don't know if you're in your car driving to work, or if you're alone sometimes, and you're just thinking about it, and you're like, wow, is this even happening? I know I wasn't alive, when the influenza pandemic broke out. So I definitely haven't had practice at handling this. So be kind to your body. Who needs a few extra naps right now? For some of us, that's a good thing of working at home right now. We get to work on our own schedules sometimes. So be active when you can, but don't force it. You're healing, and we're going to continue to do that. And some behaviors to look at. Anxiety and worry is there at the top. And in the study conducted among the Chinese, which is where the COVID-19 or novel virus virus began in Wuhan, China, they surveyed those Chinese individuals, and 42.6% of those individuals said that they were experiencing anxiety and worry related to the coronavirus. I wonder what that number would be here in the U.S. In a poll by the Kaiser Family Foundation, one of the things that they found was that some of that anxiety and the worry that we have, and especially for those of us who work in healthcare, is that we come into a healthcare facility, or we have to go buy groceries, and perhaps we're afraid that we're going to come in contact with the virus and we're going to take it home to our families, and how horrible we might feel if we do pass it on to one of our loved ones. But some other behaviors or things that we might experience right now during this time is an increase or decrease in energy. And if you'll notice, that kind of goes back to that cortisol level. And I've kind of jokingly said something about the quarantine 15 or Corin 15. It's looking like I'm getting there, but definitely irritability. And before I go any further, I want to give a little bit of a disclaimer. A lot of this is going to sound like you every day. And a lot of this is going to sound like you right now. But just because you might be experiencing some of these symptoms in each of these 4 categories doesn't mean that it's something to be alarmed about. It's certainly perfectly fine to be responding in some of these ways. We're going to talk a little bit later about when we need to take a little bit of a further step and to reach out to some help. But these are certainly normal reactions or responses that are or some behaviors that we may have. But difficulty relaxing or sleeping, we might find ourselves thinking about different things, crying, isolating, not wanting to be around any other person. We just want to be alone, not talk. Maybe we've talked about it all day long and we don't want to be around anybody anymore. Blaming others. And, I'm sure that at some point, and that seems kind of like a funny one there, but I'm sure at some point we've become angry about being in this situation that we've had. And I don't know where some of the blame has been directed, but, I've heard of various things or various people or situations that people are blaming this situation on. You watch Facebook, you see a lot of people talking about their opinions about what's happening in the stores and different things like that. And we all have different opinions. But, if you really sit back and you think about it and you put yourself in that other person's shoes, we all have our difference of opinions for some reason. But, that might just be their opportunity to be able to vent at that moment, to be able to blame. It's one of their behaviors during a stressful situation. Difficulty communicating or listening. Selective listening doesn't count husbands or wives. This is difficulty communicating or listening. And also difficulty giving or accepting help. And just to kind of give you an example of that, so a healthcare worker became sick. This person had been exposed, and on day 3 became very concerned and worried. Oh my God, I know I've come in contact with someone. What do I do? And so the healthcare worker's very apprehensive about reaching out to their boss, because they're thinking, well, if I call my boss and I say to my boss, oh, hey boss, I was exposed the other day and now I'm sick. Is my boss going to think that I wasn't washing my hands enough? We're afraid of that stigma. So we're afraid to reach out and ask for help. We're afraid of not being taken seriously sometimes. So that's definitely a behavior to be looking for. Difficulty giving or accepting help, the one we just reviewed, and the inability to have fun. I don't know. I've seen a lot of people be really creative right now, and Will and I were talking earlier about how this has kind of forced us to learn and experience some different things. And this new technology thing and sitting in front of a computer speaking to an audience is definitely new for me. And learning how to share my screen is definitely something new. So I don't know. I kind of feel like I'm growing up in the IT world a little bit right now. But the inability to have fun is definitely an indication of stress affecting your behaviors as a symptom. And your body, again, disclaimer here, all of these may at any given point seem like you are experiencing them, and it's okay. It's okay. But when they get severe is when we really want to get worried. And I'm probably going to give that disclaimer over the next 2 areas as well. But stomach problems, headaches or other pains, some aching, loss or increase in appetite. And again, you're going to see the appetite thing happen a lot. And again, a lot of this has to do with that adrenaline and that cortisol that's happening in our natural instincts, our innate abilities. Sweating or chills, tremors or muscle twitches, and easily startled. So I don't know about you, but the signs and symptoms of stress on the body, stomach problems, headaches, other pains, loss or increase in appetite, sweating or chills, kind of almost sounds like you might be getting sick. So sometimes we often mistaken symptoms of COVID-19 for symptoms of stress on the body. So it's definitely something to think about. And in the grand scheme of things, what I really want everybody to be aware of is we know our bodies, we know ourselves, and we know when something's different, and we know when to do something different. We know when it doesn't feel right. There's many of us social workers that are on this call right now, and, we teach our patients and our families and friends and other clients that we work with, to make informed decisions and to speak up on behalf of yourself and say, no, I know I'm sick. I know this isn't just this. So know the difference in how stress affects your body and how your body is responding when you're sick. So don't let it worry you if these are some of the things that you are experiencing It could very well just be related to the stress. As far as your emotions are concerned, I mean, I don't know about y'all, but I mean, when all this started happening, I was definitely afraid. I mean, fearful, definitely one of those emotions that we might be feeling. Depressed. I mean, why would we be feeling depressed? Depressed because, you know, we're not able to go see our loved ones. I mean, I have to drive by my mom's house on the street and wave at her and yell, I love her out the window. And we're not used to that. We're used to seeing each other on Wednesday nights and Sundays for church. And now we've gone to waving out the windows. So it's easy to get depressed like that. And then, of course, most of us are used to working around other workers and being around our work coworkers / friends / family. And now we're working at home. Schedules have changed. We're not in the daily routine of things. So very easy to get depressed when things like that are occurring in our lives, when anything is not usual and anything is not the ordinary. It's definitely easy to get depressed. Guilty. Why would we feel guilty? Guilty because, I don't know, I want you to think about that one for just a little bit. I want you to think about how feelings of guilt could be a symptom of stress on your body. And one thing that I like to think about is, you know, I'm coming to work every day. There's potential that I get exposed, and I'm going home, and I do worry about, you know, giving it to my family. And so I try to take as much precautions as possible. Normally I'm wearing a mask, and I told others earlier, if you've just joined us, I didn't want to wear the mask during this presentation, but we have to wear a mask all the time. Normally have my hair up and covered, and I'm normally in scrubs, but I wanted to look halfway, you know, professional for y'all today. Heroic is another emotion that we may be feeling, and that sounds a little bit unusual, but one thing that a lot of people are doing right now is stepping up. I don't know if any of you are involved in the volunteer organization Active Disaster, but I am, and there's there's probably like 160 individuals in that group. And let me just tell you, it is unbelievable at the heroes that are in that group. It is unbelievable at the things that people are doing right now. And it's possibly a coping mechanism for many. But feeling heroic, you know, feeling like, you know, I can do this. I'm going to go to the hospital and I'm going to do everything that I possibly can, you know, to make somebody well today. You know, we might get those euphoric feelings, if you will. Angry is also something that we might experience, feeling angry. You know, why did the president not do this? Or why did this not happen? You know, we might be questioning, we might become angry at some of the decisions that are being made. Invulnerable. Well, I don't know. I was hoping that a lot of people had outgrown this one. We're not invincible. We are definitely vulnerable. We may not be the most vulnerable populations, but we could possibly come in contact with some vulnerable populations. So to think that you're not vulnerable is just simply not realistic. And so having that feeling that, oh, it's not going to happen to me, is definitely not a realistic feeling to have. So if you start experiencing those emotions, it's definitely cause for alarm. Apathetic, and basically that's just, I don't care. I'm not worried about it. I'm going to go into Walmart. I'm going to push my buggy around, and I'm not going to dab. I'm not going to sneeze into my elbow. You know, it's my life, and I'm going to do what I want. I'm not worried about it. Whatever. That's definitely apathetic, and that is definitely cause for concern as well. And overwhelmed by sadness. And again, this relates directly back to depression. You know, sadness is a symptom of depression. And so being aware of those sad feelings that we may have. And the last one is the way that we think. So this sounds like me all the time, but definitely in stressful situations, these become significantly more inhibited. But trouble remembering, feeling confused, difficulty thinking clearly, difficulty concentrating, and difficulty making decisions. And again, while this may sound like you every day, all the time, what I'm asking you to look for is anything that's past your usual limit, past your outside norm. So keep those things in mind. So when And a lot of times these things are to also our bodies are readjusting to the new schedule or the new routine or the new rules that are coming out every day at work, or perhaps the new learning or the new webinar that we have to put on today, or, I mean, many different things. You know, it's a different stress. It's a new stress. And so anytime that there's change, our body's definitely naturally going to respond and react like that. And so how does all of this relate? And so all of the 4 areas come together. And as you can see, there's 4 points there on that picture: the mind, the body, the emotions, and the behavior. And so all of those symptoms coming together, they definitely point towards stress. I'm just going to leave that sitting there for just a minute. There's definitely some signs and symptoms of stress related to each one of those areas there that I didn't really mention earlier. Negativity, muddled thinking, you know, it's definitely easy to become negative during a time like this, and that could be very related to feeling apathetic. I mean, some of us may be even having nightmares or bad dreams. We may have muscle spasms, different muscle twitching or things like that are definitely things related to stress as well. We're going to talk about some coping mechanisms, or, you know, some things that we could possibly do to help with stress. But down there at the bottom, if you look under behavior, you know, we're looking at hoarding, insomnia, lashing out and violence. We talked about blaming and anger earlier. That the drug and the alcohol abuse, you know, very, very important. If you have a past experience with addiction, I think it's very important that you especially pay attention to some of these signs and symptoms that may be occurring as related to your mental health during this crisis situation. You know, be aware. If you've got a sponsor, I think it's important that you call your sponsor, you reach out to your support group. Over on the emotions, feelings of hopelessness, loneliness, apprehension, you know, definitely lots of apprehension going on. A lot of mixed emotions. You know, if I had to really just sum it up in one word, mixed emotions seems to be, you know, what most people are experiencing. So how to relieve stress. And I wish that I could just give you one prescription for this. And unfortunately, there's not. But here are some ideas. And I think, you know, it's an individual preference and some different things for you to consider and different things for you to look at. And hopefully maybe if it's not something that you're already doing, it's something that you might try to incorporate into your daily activity to help reduce stress. So keep things in perspective. I think what's important here is, you know, we can read, don't believe everything you see on Facebook. You know, we read opinions, and it's easy to feed into opinions and other people's posts and things of that nature. But remember that it is an opinion. And I'm not discrediting anybody's opinions. I mean, I respect opinions to the fullest. We all have one. We all have them, and it's perfectly fine and okay to have that. But keep that in mind, and also keep in mind that that person, like we said earlier, sharing that their opinion is their way of blaming and their way of showing their stress. So keep that in mind when you're reading some of those things. So definitely keep it in perspective. Take a step back, look at it, think about it for a minute, and maybe revisit it later. Definitely don't be reacting to anything immediately. Think about it before you react. Don't make any big decisions. Get the facts. And I think that's very important. And a little bit on further down the list, you'll see limit media consumption. And as related to getting the facts, I think it's very important. I mean, I can watch 4 different TV channels, news channels in a day, and I could hear something different on all 4 news channels. That's very overwhelming. You know, when I get a lot of different information in one day, that's very, very overwhelming. And I think what's important here is pick what media you want to look at. Pick 1, pick 2. Don't listen to all 10 of them. You know, pick the ones that you feel like are really sharing the best information. Choose the ones that are giving the true facts, you know, and make sure that you're limiting that. Don't try to watch all of them. What are your favorites? Limit it. and decide, okay, am I going to listen to the CDC? Am I going to listen to the WHO? Am I going to, am I going to follow these facts? Am I going to follow, these facts? Choose which ones of those you want to look at. They're all pretty much in line with each other, but if we start looking at all of them at one time, again, so much information is very overwhelming. And remember, what we're trying to do here is relieve some of that stress, and feelings of being overwhelmed is definitely not helping with the stress. Keep yourself healthy, and I think that is on many different levels and many different variables. Self-care, there's a good friend of mine on here who posts something every week about self-care. She finds a way to make every day a self-care day. And, for some people that may be very difficult and may seem unreasonable, but it's not. Self-care doesn't have to be an hour and Calgon take me away every day. Self-care can be 5 minutes. Self-care can be 10 minutes. And, it can definitely just be something just to help catch your breath and to settle down, to recuperate, and start again. So, self-care, very important, keeping yourself healthy. And just so you know, I think most people know this, but an increase in stress definitely decreases your immune system. And we all definitely need healthy immune systems right now. We talked about this on several of the different areas that we were discussing earlier, but paying attention to your body, your feelings, and your thoughts. Recognize when something's not right. Recognize when something's off or something's different. Notice the different, some of those symptoms that we talked about sounded like COVID symptoms, but you know your body. So pay attention. Use practical ways to relax. And this could be something as simple as deep breaths, stretching, meditating, wash your face and hands, which we're supposed to be doing anyway. Whatever it is that helps you relax, but something practical. Again, it doesn't have to be 30 minutes or an hour a day. It really doesn't. I mean, it can be very simple and it can be very short. Keep a regular schedule. That's very difficult to do in times like this, especially, if you're working in the healthcare, you're working on the front lines, things change every day. New information is coming to us every day. And, but a good way, to do that is to try to make an activity schedule for the day. Plan your day out. What time are you going to get up? What time do you normally get up to go to work? You normally get up at 6 o'clock. We'll try to keep that, same schedule. Parents, I'm talking to you out there. We encourage this with our kids. We need to be practicing it as well, because we will go back to work one day. We will come back into the office, and, wouldn't it be horrible just to have to get used to getting up that early all over again? But try to, keep some resemblance of a usual schedule. On Sunday morning, when you get ready for church, like you normally get up on Sunday morning and get ready for church, get up at the same time you normally get up to go to church. Get up, put your church clothes on, whatever you wear to go to church, put your makeup on, fix your hair, whatever it is you do to go to church, continue to do that. Try to keep some resemblance of a normal schedule in your day right now. And that's the best thing you can do for yourself. Stay connected, even if we have to do it digitally like this. Even if we have to do it, through text messages. I know that my family and I, we Facebook chatted with those filters, and half the time we haven't even been able to have a conversation because we're giggling and laughing at each other so much for the filters that we're choosing and how silly we look. So this is a really good time. And you know what? That's something that we've never done before. And that's new and that's fun and it's different. And so regardless of how much stress that these times have brought on us right now, I think, again, we're learning new things, new ways. And I think some of us might find that some of the things that we're doing right now are things we want to keep around. Exercise and stay active. I mean, I don't know about y'all, but I'm really glad to see some sunshine. It's not very sunshiny out today, but with all the rain that we had, over the last several weeks, the sunshine has been really good. Some vitamin D is always, and some fresh air is always good for you, to be able to get out and to walk a little bit. And I'm not saying run a marathon like Will or, some of these people that you see downtown Gadsden, but I'm saying, get some fresh air, vitamin D, go sit on the front porch. Where can you get some sunshine? Wear your sunscreen. Limit your media consumption. We talked about that earlier. Distract and redirect. Now, just so that you'll know what I mean by there, distract and redirect. And what I'm talking about is something such as watching a movie, helping someone else. We talked about the heroic feeling earlier and how, so many people are stepping up right now, and it's really nice. And I think that's why you see that happen a lot of times in times of crisis. It's because that for a lot of people is a coping mechanism to, if you're having a bad day, just think of how good you might feel if you're able to really help somebody. If you're able to take some groceries to them or call and check in on them and see how they're doing, it really might make a big difference in your day, to know that you brought some joy to somebody that may not have heard their own voice for that day. So those are some things about directing and redirecting. What are some things that you can do to distract yourself? If you become very overwhelmed, if your thoughts, start racing about what's going on, definitely do some direct and redirecting. We do it with our kids. We just have to learn to internalize that and to be able to self-discipline and be able to do that. And get creative. I've seen a lot of people doing some DIY projects around the house, and I've seen some pretty neat ones, things that they don't have to go to the store and buy things for. Maybe you've got an old piece of furniture laying around at home that you haven't had a chance to get around, and now's the time to do that. So keep that in mind. We're almost finished. For employers, what to do. Show empathy and be available. I was talking to you earlier about the person who got sick and was afraid to go to their boss. And, fortunately, that individual's boss was like, you know what? I think it's better safe than sorry. Go get tested. Stay connected. Check in with your employers. We talked about that earlier about leadership and management in the workplace and what they can be doing to help their employers or their employees. Recognize the impact. You're feeling the stress. Your employees are feeling the stress. We're all feeling the stress. And we can actually really do some good for each other if we really pay attention to each other. And it's a good time to come together and to be beneficial to each other. Encourage training. Maybe this is the time to learn something new, for some on-the-job training at home, some webinars, lots of webinars. Lots of people are starting to offer some webinars for free that are ordinarily very costly. Or maybe it's time just to hone in on some new skills. If you have an employee assistance program, it's very important that you let your employees know and be aware of that employee assistance program. Those employee assistance programs are so much more valuable than I think most of us even realize. They can direct us to resources or places in which our insurance will cover and can be a very, very valuable resource for us. As employees, what we can do, continue our treatment and medication. If it's our normal medicine, let's continue to take it. Respond to the symptoms of COVID-19. If you're in doubt, you need to let somebody know. If you're experiencing some of those symptoms that we talked about earlier and you're not sure if that's your body reacting to stress, err to the side of caution and get tested. It's better to know than not to know, and at least put your mind at ease. Recognize the signs and triggers. And so that's one of the reasons we went through the 4 areas today, and we looked at some of the signs and the different things to look for and the triggers. What is making that stress happen? What is making that stress happen? Engage your support network. So your loved ones, your friends, your families, your coworkers, the people who are important to you, people that you know can trust. The International Critical Incident Stress Foundation Incorporated, Will is recording this. You can come back and take a look at this, but this is something that I wanted to put up here. There is some of the stressors, that they're listing there, the stigma, symptoms and rapid deterioration, high mortality rate, the strict procedures and the things that we're having to do, some stress management things down at the bottom, monitor and talk with colleagues and journal. Those are some things to do, and avoiding self-medication are all some of the stress management tools that we can use there. So how do you feel? And I put this little cute little picture thing up here for you all to look at, and it is the Simple Mental Health. I can't see what it says there, but it is the Simple Mental Health Pain Scale. We've all been in the hospital at some point or another, I think, and the nurses said, how is your pain on a scale of 1 to 10? So if you look at that and you're mild, you're moderate, you need to know where your limits are and at what point do you need to reach out and get help. Very important to know your limits and when you need to reach out. And so it's not only important to know when to reach out, it's not only important, why is that doing that? Not only important to know when to reach out, but it's also important to have resources in which to reach out to. So I want you all to take a picture of this with your phone, write the numbers down, whatever it is that you need to do to write some of these numbers down. And there's one that I did not list that I want to give you the information for before we get off of here. But the Disaster Stress Helpline, that is with SAMHSA, and you can text to talk to them, or there's a 1-800 number. This is the Justice Fairness Hope. That is something new that I discovered the other day. Some of you social workers that are online may want to write that number down, because this is some legal assistance and where they're offering assistance with evictions, employment issues, car repossessions, and other benefits. And of course, the National Suicide Prevention Hotline, 1-800-273-TALK, and their website there, suicidepreventionlifeline.org. If there are any veterans on here, or if you know of any veterans, I think it's very important that we get this telephone number to them as well. And then the SAMHSA National Helpline, 1-800-662-HELP. Of course, we always have 911, and that gets you directly to the dispatch within your area to be able to have police, fire, or medics en route to you immediately. We have our CED Mental Health Center that is available, and we have Gadsden Regional Medical Center emergency room and other local hospital emergency rooms. I have two things that I did not put on here, but that I want you to take note of. One is Alabama Arise, and their website is, if you have something to write with, is AlaRise, and that is ALARISE.org. There, if you go to that website, there is a handbook for how to get help. So that information tells you different things on how to work on getting your unemployment, how to get financial assistance, how to get medication assistance. So again, a valuable resource for you or someone that you may be helping. Also, I want to, for the professionals here on the line today, this is not a hotline, but it is an easy access way to make a referral to Gadsden Regional other than just sending directly to the emergency room. We have an intake line, and I will give you that number if you're ready to write down. It will be on the recording, but the number is 256-413-6446. 256-413-6446. Gadsden Regional Behavioral Health Services intake line. And again, I want to thank you so much for joining today. It's been a pleasure, new learning opportunity for me today. And without further, I've listed my cell phone number there if I can be of any of assistance to any of you, if I can answer any questions about what I've talked about today in private, or if I can assist you in tapping into some resources or anything of that nature, or assist you in helping someone else, I'll be happy to do that. And we'll open the floor up for questions and answers. Back to you, Will. Thank you. Did Will leave me?
Well, Will might have had to have taken a call or something. It's Heather.
Okay.
I appreciate you
Heather.
so much. I thought this was wonderful information. We will give you guys just a second. If you have any questions, you can feel free to unmute yourself or put it in the chat.
I think Will may have had everybody muted. That's one reason I was asking him. And I was looking, since he made me an administrator, if I can unmute everybody.
People can unmute themselves. Yeah.
Okay.
The way this is set, it's not we didn't lock it out. They can unmute themselves. But Will lost power. I noticed that I had a missed call from him. I had my phone on mute. Oops.
Oh, well, no. Our power was flickering.
Oh, no. That's crazy. Jeff Huey and Tammy Jackson, both, they all want to thank you for your time today. I think everybody appreciated. We had
Thank
about
y'all.
30 callers in on this, so this was
Oh,
absolutely wonderful. We appreciate your time and your willingness to help us out. And we are all in it together.
yes, we absolutely are, and I definitely think it's important for us to remember that. Betty, you need to mute your microphone, and Betty's my mom, so I can say that to her. But yes, we are all in this together, and I definitely appreciate you all taking the time to be on here today. And if I can be of any of assistance, just let me know.
Thank you so much. Everybody have a great day, and we will see you all soon.
Yes.
Thanks.
Bye.